This film explores the complex decisions around prescribing valproate, a medicine that can be life-changing for some people with epilepsy or bipolar disorder when other treatments haven't worked, but which carries serious risks to unborn babies and is rarely a first choice. Through the powerful voices of clinicians, people taking valproate, and families supporting loved ones, the film explores what honest, supportive conversations about medication can sound like.
Immediately, as soon as I went onto valproate, my mental health was a lot better. I'm not anxious anymore. I'm not depressed anymore. All of the side effects that I'd been dealing with for 16 years of my life went away. So there's precautions you have to take to make sure you don't become pregnant. But for me, it's 100% worth it.
I've been seizure-free for over 20 years. And that for me is a huge benefit because I can live my life normally. Yes, I take my tablets in the morning, but by the by, I live a normal life. I have to make regular adjustments throughout the day, but it's a normal life. It's not interrupted by seizures. My life is not put at risk.
So for any situation where we are considering something that comes with risks and benefits, we go through what are the advantages of being on something and what are the disadvantages of being on that and what would happen if we were not on that medication. And sometimes there's so many different factors. So I do find the clinical decision tool, the valproate clinical decision tool, helpful to discuss about sort of pros and cons on being on valproate, because that helps identify what factors are important to consider when making that decision. So things like generalized tonic-clonic seizures, how important is seizure control at that stage in life, and then with that bring in what are the alternative medications, what would happen if we switched, what would happen if we didn't switch. So it's laying out that information in a way that they can understand. It takes time because we have to talk about the pros and cons of each option. And the other thing I tell my families is whatever decision we make today, that is not a permanent decision. Next appointment, if you change your mind, you have more questions to ask, if whatever we've done is not working, we review that again.
Make sure the patient understands both the potential benefits and the possible risks of this drug. I explained that the valproate can be very effective in controlling their seizures, which can greatly improve their quality of life and reduce the risk of seizure-related injuries. I also discuss potential risks, potentially around the pregnancy, as valproate can cause harm to unborn babies, and I outline other possible side effects, such as, for example, weight gain, hair loss, some effects on mood, and explain the importance of regular monitoring. I encourage our patients, while I'm giving this information, to actually ask questions so that I understand that they understood the information I provided.
There are, of course, patients with epilepsy who have a learning disability or whose first language isn't English. And generally, we make communication as easy as possible for them at every consultation. So it wouldn't just be about the valproate form, because, of course, it's just as important I have good communication related to their epilepsy management overall, and making sure, for example, medication changes are clearly communicated. So with the instance of English not being the first language, in the NHS setting, I do have access to phone interpreters, occasionally face-to-face interpreters, and of course, sometimes patients will come in with a family member. Then in the context of people with learning disability, now the valproate patient guide, patient card, there are easy read versions of that, and it's also about giving patients enough time. So for a patient who is not familiar with that, it might be worth sending that out, or giving them the information in the appointment and saying, let's catch up about this later on, and essentially be about explaining it quite slowly. And so I tend to go through the form bullet point by bullet point at each line where we consent, with a bit of background about why this came about in terms of what we've learned about the risks of sodium valproate in pregnancy. I do preface that with saying sodium valproate is also a very effective epilepsy medication, and it still has a role in treating people with difficult to control epilepsy. But we have to be very careful about these risks and making sure people know about them. And we want to, of course, minimize the risks. And we want to minimize the chance that any woman gives birth to a child who has either learning disability or autism or a physical birth defect.
I have been on this for like 40 years, and I've got to go back through a 2 consultants sign off to say I am allowed to have it. I can't even put into words how it made me feel. It was just horror, pure horror. And the time frame of waiting to find out if the other consultant had signed it off was unbearable. I asked, well, what happens if the other consultant doesn't agree that I should remain on it? What's the process? Well, they will call you in and we'll have a, we'll all have a chat. And I was like, okay. I said, but what if that consultant doesn't agree? Even after that chat, what's the process? Like, what happens? Where does it go?
Understand patients' needs and actually concentrate more on those patients that are being diagnosed with epilepsy on a daily basis. Allow the clinicians and the GPs to work on those cases rather than worrying about reviewing a situation with me on a yearly basis because they have to tick boxes.
It has not been very clear who would that second signatory be, and how would we find a clinical time to do that. So we have had difficulties with time and with capacity in getting that second signatory. However, it is very important to have that in place, especially in some of these complex cases where we aren't sure about whether it's the right treatment for the patient. So I feel it adds another layer of safety in making sure that we absolutely prescribe it to women who really need it, or to a person who really has to be on valproate and can have the necessary compliance.
Where we've had access to an epilepsy specialist nurse working, let's say, in partnership with their neurologist, that can be invaluable and a real game changer. We were introduced to an epilepsy specialist nurse there who was an invaluable interpreter, I would say, in terms of we'd have the consultant meeting, which often would leave us punch drunk, I think, really, in terms of the information we'd received. And she would then have the time to say, do you want to sort of dissect that a little bit and tell me a little bit, questions you might have, or we can go into that. That was incredibly helpful.
I would say overwhelmingly people who are on valproate love being on valproate, and it's working for them, and often it's been the only thing. I hear that such a lot. It's the only thing that's ever worked for me. It's the only thing that controls my seizures. And I reassure patients, this process is not about taking you off medication that's working well for you. We've got to find out what's happening for them and whether this is an appropriate medication for them. And that's the sort of first part of the consultation. And I think if they see that you're coming at it from that point of view, and you've reassured them that this is not about taking them off something that's working well, then I think they're much more open with you. And then you can move into the second part, which is around the contraception and the pregnancy risk and those sorts of things. And I, hopefully they'll be more relaxed and willing to discuss those issues with me.
It is a big choice going on valproate, because obviously you're also choosing to be child-free at that time, for the duration that you're on valproate. So definitely think it through, like properly think it through, which people would anyway, but have that in your consideration. But it is, from my point of view, worth it if you're someone who does want to be child-free. Even if your body changes a bit, if you change a little bit, if it can take away those negative mental health things, if it can take away depression and anxiety, like if your body changes a bit, you can go to the gym, you can monitor your nutrition, you know, you can learn these things about nutrition, about your brain, just to like make little changes. That's an easier thing to change within yourself as opposed to trying to fix your brain, which, you know, is such a crazy thing to try to get to understand in the first place.